preschoolers, is neurofeedback combined with behavioral therapy superior in effectiveness to behavioral therapy alone? So we all know that ADHD is an impairing condition that widely affects a child's life. Current treatment guidelines for preschool-age children with ADHD suggest prescribing evidence-based behavioral therapy as the first line of treatment. However, there are reports of its limited efficacy. For non-respondents in moderate to severe cases, psychostimulants such as methylphenidate can be prescribed, but its use may be challenging in preschoolers. One of the problems is the ability of little children to swallow medication in addition to adverse effects. Therefore, there is a need for studies that address the application of non-pharmacological therapies in preschoolers, like neurofeedback. Neurofeedback, or brain training, has been shown to have persistent effects months or years after the treatment sessions, without any significant adverse effects. So, we plan to perform a multi-center randomized open-label parallel group phase 3 study to test whether neurofeedback, in addition to behavioral therapy, is superior to behavioral therapy alone in preschoolers with ADHD. This is an open-label study due to the complexity of the setup for performing neurofeedback. In order to avoid the surrounding effects of the neurofeedback package, we will not perform sham procedures in the control arm. Patients eligible for the trial must have an age from 4 up to 6 years old and a confirmed diagnosis of ADHD without any previous ADHD treatment. The intervention group will receive up to 48 neurofeedback sessions in 24 weeks with 6, 12, 24, and 36-month follow-up. After that, participants will stop the neurofeedback treatment and will continue standard treatment, which is behavioral therapy, as usual. The primary outcome includes the improvement of ADHD symptoms in preschoolers measured by the ADHD rating scale 4. The assessment of the primary outcome will occur after 12 months of follow-up, with the main outcome being measured as a continuous variable, and an unpaired t-test will be used to assess for between-group differences on the score at the specific scale. Regarding the sample size, we calculated that a total of 274 participants will be needed. Then, after 6 months, participants will be allowed to use medication. In that sense, our secondary endpoint was a time to drug use, using Kaplan-Meier survival analysis. We speculated that subjects on neurofeedback treatment will require less drugs to control symptoms versus the control group during follow-up. In conclusion, this is an innovative effectiveness study of neurofeedback to treat symptoms of ADHD in preschoolers. If positive results are obtained from this study, it may change the landscape of treatment in preschoolers who typically have difficulty adhering to drug-based treatments.